Hi, I'm Marie Hopkinson and I'm a Chinese medicine practitioner. Today I want to talk to you about classical Chinese medicine versus stock standard TCM or traditional Chinese medicine. So what do we do with the pulse diagnosis? So we're basically checking, you'll see a practitioner, if you've had Chinese medicine before, the pulse taking might not seem too different from TCM pulse taking, except that maybe it takes a little longer. It depends on the style that you've had before. And so what we do is we're checking like there's three positions on your pulse. So we call that the Sun, the Guan, and the Che position. So like basically these three fingers will check those different positions. And what we're doing is we're feeling in a very rough sense on both sides of the body, like what's the difference in the functional changes of your body? Has it had functional changes? Has it had material changes? So a functional change is kind of like it in a car. If the car runs out of petrol, you put some petrol in, off it goes again. That's kind of a functional change. It's just a little thing that's gone wrong and it just needs a little tweak, or it just needs some substance in it, and off it goes again, right? Whereas a material change is kind of if that car runs out of petrol and it's been on the side of the road for a while and it's like rusted out a little bit, and one of the fuses is gone, and then the wire's kind of deteriorated, and like there's all these things that have gone wrong with it, and it's actually like started to wear out, or parts have worn out to the point where we can't just put petrol in and off it goes. You have to actually replace those parts or start, get in there and work. And what happens is in a material change, even in a vehicle or something like that, is that the body will start, because one part's worn out more, other parts have to work harder. And this is, any mechanic will kind of tell you this in a car. When you have an old car and it might be going great for like 10 years and then something breaks down, as soon as one thing breaks down, then you put a new part in, it affects all the other ways, all the way the rest of the body kind of works. Now, in Chinese medicine, we're not replacing your heart or replacing your kidneys, like in Western medicine, in that, like, it's not that, that is material change, but we're not replacing that level of material change. And if you need that, then Chinese medicine is probably not the right place for you to come to. You need to go to a surgeon and get a heart transplant if that's where it's gotten to. But before it got to that level, there would have been some other material changes that's happened. And so how can we help you affect that, like get that, let's restore that functional change first. If the body's got to the point where material changes happen, then how can we assist the body to repair itself and restore itself, and then sometimes even just maintaining your health without getting any sicker is all that can be done for some people. And that can also give you much great relief of symptoms, and you can feel really good. But if you stop taking the herbs, then the symptoms kind of all sort of come back again. That's because often a person has gotten so sick that's basically the level of where they're at. If you just get a cold or a flu, that's considered like a functional change. And quite often in a healthy person, like you think of little kids, they're very healthy when they're, as an average little kid, they're born quite healthy. Then they get a cold or a flu, they might get very sick, but they can get better really quickly as well. And quite often the body has the ability to heal itself, to get better itself. And so Chinese herbs are there to facilitate that, what's meant to happen, and to assist the body doing that. And for some people, just to facilitate that quicker than that, rather than have symptoms kind of linger on while the body takes its time to get better, and to relieve the discomfort that you feel from those symptoms as your body does get itself better. So with pulse diagnosis, what we're doing is we're feeling, the system I practice basically allows a practitioner to feel the body's need for particular herbs, which is very different to the stock standard TCM way. So what we can do is we can feel in the pulse whether your body needs a particular herb, and then we have to know what formulas that contain that herb, and also have the knowledge of those formulas. Are they appropriate for that person? So for instance, if a person needs cinnamon, guizhi, then that's one position on the pulse that would tell you that. Then there'll be other positions on the pulse that we might know, okay, there's a formula that's got guizhi and it's got baishao in it. So is that out of those formulas with guizhi and baishao, which is the appropriate one for that patient based on the symptoms they have? And that information then comes from the textbook knowledge of those formulas, how those formulas were written, what conditions they were used for, what conditions can it be used for. is that an appropriate use of that formula? And that's where the practitioner will check your pulse and then maybe ask you some additional questions. So they might check your pulse and say, do you have gas and bloating? Do you feel uncomfortable? Because they might feel the need that you have the need for a particular herb that treats that. And so whether we put that formula or that herb in your formula is dependent on whether you have those symptoms or not. Sometimes particular feelings in the pulse can relate to 2 or 3 different herbs, and it's not until we ask you the symptom questions that we work out, is that relating to a herb that treats gas or bloating, or is that relating to a herb that treats like a deficiency problem in your body or something else, if that makes sense. So it is very specific, but it can also be what I'm saying is there's some feelings in the pulse that are really spot on in terms of that setting. There's an exact formula for that exact pulse that you have. And then there's a lot of pulses where there could be 2 or 3 formulas that could be used based on the feeling in the pulse. And so a practitioner may then have to ask you several questions to work out what is the right formula. And I'll always keep patients informed as best I can along the way and say, look, this is what we're giving you now, this is where it's going, you might need to take this for a certain amount of time. And there's a process that we use in the system I practice called Harmonizing. And what that means is often the first few formulas you take, or first 1 or 2 formulas, first 1 or 2 weeks of taking herbs, sometimes up to a month or 6 weeks or so, your body might need supplementation, or it might be showing material change. It's what we call taxed or weak, and it needs substance put into it. But if we put that substance in and your body can't absorb it, it's not going to do any good for you. So we need to harmonize you. We need to make sure that your digestive system's working properly. Some patients that have extreme constipation, let's say, for instance, they're so blocked up that they wouldn't be able to absorb the nutrients anyway. Or the opposite can happen. Some people can have such bad loose or diarrhea that you put nutrients in their body, even like they take supplements or vitamins, and they're just wasting their money because it's just being pooped out of them so quickly. They can't keep even the fluids in their body. So these are all specific questions. The good thing with Chinese herbal medicine is that it's very specific to your body. Your practitioner, like me, when I'm checking your pulse, it's going to be exactly we're checking your pulse, and it's the formula we give you is specific to you, not specific to, okay, you've come in, you've said I've got diarrhea. Oh, here's 5 formulas that can treat diarrhea. Let's pick one of those. No, it works the other way around. So we check your pulse and we'll say your pulse says your body needs. So if you had the diarrhea, you might need like tonification, let's say, is a very general sense. And you might need herbs to kind of keep the fluids in your body. And then we might need to ask you some more questions about that. Or sometimes people have diarrhea and they actually need to get get a purge out, and then everything's basically get the stuff out that's causing the problem, and then everything's okay. And that's all based on your pulse and based on the symptoms that you have and the questions that we ask you. And then after those initial symptoms are treated or those are addressed with the herbs, then we can work on other things that are bothering you, or things where Chinese medicine practitioners would consider like more the pillars of health. So things like your sleep and your digestion, and is your body able to make the nutrients it needs to out of your digestive system? If that's not working properly, then that's a massive issue going forward for your body. So they're the things Chinese medicine practitioners really care a lot about. Like, so if they most practitioners are going to ask you about your bowels, even if you've got back pain, have you got regular bowel movements, have you got good sleep? That's their common questions to ask, because we might treat the pain first, but then going forward, how's your body going to make the nutrients it needs? Especially if you've got a chronic problem, like if you constantly get pain, like every time it's a weekend you get a headache, or every time the in-laws come over you get super stressed and you're getting a migraine, or you get vomiting or something like that, then that's showing you that your body's got some sort of imbalance in it, because this is always happening. This is constantly happening. Even stress and anxiety or mental health symptoms, often the way that Chinese medicine looks at those things is through a physiological framework. So we're looking at the physical aspects of your body. How is that out of balance? And then if we can rebalance that, then your body's we can rebalance the physical part of your body, then it can control the emotions. It can look after the mental health aspect itself. That's the fundamental premises of Chinese medicine. So I hope this video has been informative to you. I welcome you to my practice if you're interested in looking at Chinese medicine as a treatment for yourself, particularly classical Chinese medicine. I hope this has answered some of those questions. What's the difference between the stock standard TCM and classical Chinese medicine? What is pulse-based herbal medicine, and the style of Chinese medicine that I practice, which is I'll put a link in the description below. So there's a lot of practitioners that do this style. There's about sort of 300-400 in the world that do this style of Chinese medicine. The training school is called Institute of Classics in East Asian Medicine, and that's run by Arnold Versluis. So if you want to study that style of Chinese medicine, then there's the link below is going to be below there, so you can click on that. Cool. So hopefully this video has been informative to you, and if you've got questions about possibly becoming a patient of mine, or maybe you're watching this video and you're not even in Australia, and you think, I'd like to have some treatment, I can only treat patients who can come and see me because of the pulse-based aspect of it. I can't treat patients remotely. So sometimes I can care for patients remotely in some way, but usually it's better if you can come and see the practitioner personally, depending on definitely you need to be able to do that for the first 2 or 3 treatments at least. Sometimes I can give patients herbs ongoing. Often I give patients, they can stay on herbs that have been working for a while, but eventually they need to come back and have their pulse checked. If something changes, they need to be able to do that. So you want to find a practitioner who's close to you. So if you do want to find a practitioner that's in our lineage system, then I can give you a list and you can find a referral through that way. So thank you so much for watching, and I'd love you to place a comment in the comments below. I love your comments. I love to hear your feedback if you've found this video helpful, useful to you, and if you've got friends or family that are in Perth that would like to come and see me, please send them along. I love seeing new patients. Thank you.